Necrosis. Necrosis is defined as a localized area of death of tissue. Here the important point is, what is necrosis? It is a localized area of death of tissue followed by degradation of tissue by hydrolytic enzymes liberated from dead cells. It is invariably accompanied by inflammatory reaction. So, localized area of death of tissue. Necrosis is localized area of death of tissue. Necrosis can be caused by various agents like hypoxia, chemical agents, physical agents, microbial agents, and immunological injury, etc. Two essential changes or characterize irreversible cell injury in necrosis of all types, that is cell digestion by lytic enzymes, and another one is denaturation of proteins. One is cell digestion by the lytic enzymes, another one is denaturation of proteins. Next, moving on to types of necrosis. There are 5 types of necrosis or morphologically, that is coagulative necrosis, liquefaction necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Let's see about coagulative necrosis. This is the most common type of necrosis. So, the most common type of necrosis is coagulative necrosis, caused by irreversible focal injury, mostly from the ischemia and less often from bacterial and chemical agents. So, most due to the ischemia and less due to the bacterial and chemical agents. What is ischemia? Sudden cessation of blood flow. So, the organs commonly affected are the heart, kidney, and spleen. Coagulative necrosis is affect the heart, kidney, and spleen. So, the most important points are, most common type of necrosis is coagulative necrosis, and what is ischemia, and the mostly common affected organs are heart, kidney, and spleen. Next, moving on to gross appearance. Grossly, foci of coagulative necrosis in the early stage are pale, firm, and slightly swollen. With the progression, they become more yellowish, softer, and shrunken. Next, moving on to microscopically. In microscopical appearance, the hallmark of coagulative necrosis is the conversion of normal cells into their tombstone appearance. Here, what is tombstone appearance? The outlines of the cells are retained so that the cell type can still be recognized, but their cytoplasmic and nuclear details are lost. So, these tombstone appearance are present. The necrosed cells are swollen and appear eosinophilic than the normal, along with the nuclear changes. But the cell digestion and liquefaction fail to occur. If it occurs, it is a liquefactive necrosis. The necrosed foci is infiltrated by inflammatory cells and the dead cells, phagocytosed by leaving granular debris and fragments of cells. So, here it is a microscopic appearance of the coagulative necrosis, showing the left side is viable renal tissue and right side is necrotic tissue. In between there is inflammatory cell infiltrate. So, this picture is coagulative necrosis infarct in kidney. The affected area on the right side shows cells with intensely eosinophilic cytoplasm of tubular cells, but the outlines of tubular cells still maintained. The nuclei show granular debris. Second type, liquefactive necrosis. It is also known as coagulative necrosis. Liquefactive necrosis or coagulative necrosis commonly due to ischemic injury and bacterial or fungal infection. It occurs due to degradation of tissue by the action of powerful hydrolytic enzymes. So, the important point here is liquefaction necrosis is also known as coagulative necrosis, and most commonly liquefactive necrosis occurs or affect the brain and abscess cavity. So, examples are infarct to brain and abscess cavity. Next, moving on to gross appearance. The affected area is soft with liquefactive center containing necrotic debris. And later a cyst wall is formed. So in center there is soft liquefactive center that containing necrotic debris, and after cyst wall is present. Microscopically, the cystic space contains necrotic cell debris and macrophages filled with phagocytosed material. The cyst wall is formed by proliferating capillaries, inflammatory cells and gliosis in case of brain, and proliferating fibroblast in case of abscess cavity. If it is affect the brain, there is presence of proliferating capillaries, inflammatory cells and gliosis in the cystic wall. If it is abscess cavity, there is proliferating fibroblast are present. So these are the microscopic features of liquefactive necrosis. Let's discuss about liquefactive necrosis in brain. Here this picture showing liquefactive necrosis brain. Here the right side is liquefactive necrosis. Shows containing cell debris, while the surrounding zone shows granulation tissue and gliosis. So granulation tissue and gliosis are present. Liquefactive necrosis contains, in center there is cell debris is present. These are the example of brain infarction. The third type of necrosis is caseous necrosis. It is found in the center of foci of tuberculous infections. It is very important, center of foci of tuberculous infections. It combines features of both coagulative necrosis and liquefactive necrosis. So, caseous necrosis is the combined feature of coagulative necrosis and liquefactive necrosis. Next, moving on to grossly appearance. Foci of caseous necrosis, as the name implies, resemble dry cheese and or soft, granular and yellowish. So, resemble dry cheese appearance. This appearance is partly attributed to the histotoxic effect of lipopolysaccharides present in the capsule of tubercle bacilli, that is Mycobacterium tuberculosis. Next, moving on to microscopic features. Microscopically, the necrosed foci are structureless. It is very important. Necrosed foci are structureless, eosinophilic and contain granular debris. The surrounding shows characteristic granulomatous inflammatory reaction consisting of epithelioid cells with interspersed giant cells of Langerhans or foreign body type and peripheral mantle of lymphocytes. So, what are the cells are present here? Mainly necrosed foci are structureless and eosinophilic and containing granular debris. Here the important is granulomatous inflammation. So, this picture shows granulomatous inflammation. So, caseous necrosis, presence of granulomatous inflammation, and in between this there is viable lymphoid tissue is present. The fourth type of necrosis is fat necrosis. Fat necrosis is a special form of cell death occurring at two anatomically different locations but morphologically similar lesion. So, two anatomically different locations but morphologically similar lesions. These are, one is acute pancreatic necrosis and another one is traumatic fat necrosis commonly seen in breast. So, pancreatic necrosis and traumatic fat necrosis occur in breast. In the case of pancreas, there is liberation of pancreatic lipases from injured or inflamed tissue that result in necrosis of the pancreas as well as the fat deposits throughout the peritoneal cavity and sometimes even affecting the extra-abdominal adipose tissue. So, the fat necrosis hydrolyzes neutral fat present in adipose cells into glycerol and free fatty acids. The damaged adipose cells assume cloudy appearance. So, the important feature is cloudy appearance. The leaked out free fatty acids complex with calcium to form calcium soaps. This process is called saponification. So, in fat necrosis, the important complex formed is calcium soaps. In gross appearance, fat necrosis appears as yellowish white and firm deposits. Formation of calcium soaps imparts the necrosed foci firmer and chalky white appearance. So in gross appearance, chalky white appearance is present. And next moving on to microscopically. Microscopical features, the necrosed fat cells have cloudy appearance and are surrounded by the inflammatory reaction. So formation of calcium soaps is identified in the tissue sections as amorphous, granular and basophilic material. So the cloudy appearance is very important. Is the characteristic features of fat necrosis. Here this picture is showing fat necrosis in acute pancreatitis. There is cloudy appearance of adipocytes, coarse basophilic granular debris, while the periphery shows a few mixed inflammatory cells. So it shows cloudy appearance and mixed inflammatory cells in the periphery of this cloudy appearance. The fifth type of necrosis is fibrinoid necrosis. Fibrinoid necrosis is characterized by deposition of fibrin-like material which has the staining properties of fibrin. So deposition of fibrin-like material which has the staining properties of fibrin. It is encountered in various examples of immunological tissue injury. Example is immune complex vasculitis, autoimmune diseases, Orthus reaction and etc. Arterioles in hypertension and peptic ulcer. These are the examples for the fibrinoid necrosis. So fibrinoid necrosis is the deposition of fibrin-like material. Here the microscopic features are bright. Fibrinoid necrosis is identified by brightly eosinophilic hyaline-like deposition in the vessel wall. Necrotic focus is surrounded by nuclear debris of neutrophils. Local hemorrhage may occur due to the rupture of the blood vessel. So here the hyaline-like deposition in the vessel wall and bright eosinophilic. The necrotic focus is surrounded by a nuclear debris of neutrophils. Local hemorrhage mean to the rupture of the blood vessel. Here this picture showing fibrinoid necrosis in the autoimmune vasculitis. The vessel wall shows brightly pink amorphous material and nuclear fragments of necrosed neutrophils. In center there is a nuclear debris and fibrinoid necrosis. In fibrinoid necrosis there is nuclear debris and viable polymorphic neutrophils. Let's discuss about some MCQ. First question is coagulative necrosis is option A characteristic of focal bacterial infections, option B characteristic of hypoxic death, option C characteristic by loss of tissue architecture, and option D none of the above. So coagulative necrosis is here the answer. Coagulative necrosis is option B characteristic of hypoxic death. It is due to the stoppage of the blood flow, that is ischemia. Question number 2. Liquefaction necrosis is commonly seen in option A brain, option B lung, option C liver, option D spleen. So liquefaction necrosis is commonly seen in these are the options. So option A brain is the answer. So liquefaction necrosis is commonly seen in brain. Next moving on to question number 3. Which of the following is correctly matched? Option A coagulation necrosis, TB. Option B cessation necrosis or caseous necrosis in yellow fever. Option C fat necrosis in pancreatitis. Option D gamma in infarction. Which of the following is correctly matched? So the answer is fat necrosis in pancreatitis. fat necrosis commonly in pancreatitis, and traumatic fat necrosis occur in breast. Question number 4. Hypoxic death leads to option A, liquefactive necrosis, option B, coagulative necrosis, option C, caseous necrosis, option D, fat necrosis. So, hypoxic death leads to which type of necrosis? So, the answer is option B, coagulative necrosis. So, hypoxic death leads to coagulative necrosis due to ischemia. Question number 5. Cessation necrosis is suggestive of option A, tuberculosis, option B, sarcoidosis, option C, leprosy, option D, midline lethal granuloma. Cessation necrosis is suggestive of which of the following? So answer is option A, tuberculosis. Definitely cessation necrosis is present in the center of the foci of tuberculous infection. So answer is tuberculosis.